Elaine present some of the things that she was able to dig into and some of the data that she collected. So I'm going to let her do that.
All right. Hello, everyone. My name's Elaine, and I'll be talking about trauma in first episode psychosis. Before we start, you will receive an email regarding a SAMHSA pamphlet talking about trauma, PTSD, and first episode psychosis. I don't know if you can see that, but that's what you'll be getting, okay? So let's begin. So trauma is defined broadly as an event, series of events, or a set of circumstances that is experienced by an individual that is physically, emotionally harmful or life-threatening and has lasting adverse effects on the individual's functioning, mental, physical, social, and emotional, spiritual well-being. This is a definition of trauma that is on the SAMHSA website and is the broad one that a variety of different experiences can fall under. I did want to also talk about the ACEs, or the adverse childhood events, that include some more specific types of trauma, in particular for our pediatric population. Those include physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, intimate partner violence, particularly if witnessed violence on the part of the mother, substance misuse in the household mental illness, separation, divorce, and an incarcerated family member or household member. Those are the original 10 or 11 ACE experiences by the original article from 1998. Other traumas to consider in our global community and in our constantly shifting demographic are natural disasters, community violence, acts of war, terror, or displacement, and military experiences, those who have served in the military and are coming back.
Can I ask a question?
Yes.
Yeah.
Do you mind waiting till the end for the questions?
Okay. So these are just as an overview, just the original findings, the findings from the original ACEs study, which are widely considered to be underreported. So 28 of the study participants reported physical abuse, 21 reported sexual abuse, 15% reported experiencing a divorce or parental separation, having a parent with mental or substance use disorder. So 40% of the sample reported about 2 ACEs, and another 12.5% experienced 4 or more ACEs, which is considered to be a heavy load.
And Elaine, I'd like to mention too that this original study was actually conducted on a very middle-class population. So when we think about trauma, we also often think about poverty. And this was like your standard, incredibly white, fairly well-to-do private insurance population of folks. And this is the levels that they were reporting.
Yes, it's very important to consider when we're talking about trauma, to not buy into societal expectations. As Nicole said, this was a very middle-class private insurance, predominantly white population. So cumulative ACEs were also found to have a strong graded relationship to numerous issues throughout their lifespan, including substance use, mood disorder, psychosis. And another thing to be aware of is comorbidity of a variety of psychiatric illnesses and physical ailments. So prevalence in trauma, a little bit more updated statistics nationwide cites it to be about 15 to 25% of people will have a history of sexual abuse in childhood or adulthood. In persons with psychosis, this jumps to 50 or 60 or greater, as cited by some studies. The prevalence of domestic violence in the United States is approximately 20%, and violence experienced by patients with psychosis is 60 to 70%. 18.5% of returning veterans reported symptoms consistent with post-traumatic stress disorder or depression, which can be a precursor to psychosis. In the United States, 20% of men approximately and 15% of women reported a lifetime experience of natural disaster. I'm just thinking about our current situation. We're over 10 years from Hurricane Katrina, last year's Hurricane Maria, and I believe this week's hurricane affecting the Carolinas. So as we have more extreme weather, this is something to consider as well. So childhood abuse and neglect does have a dose-response relationship to development of psychiatric disorders, including anxiety, mood disorder, substance use, and eating disorders. All of these can be precursors to a psychotic disorder. Patients with childhood trauma also have poor psychosocial functioning and work performances. So if you're seeing a child who's doing poorly in school, or a young adult who is doing poorly in college or at their job, this is something to consider. Patients with high number of ACEs are more likely to report suicidal attempts, high-risk sexual behavior, dissociative symptoms, all of which can lead to increased hospitalization and at an earlier age. So this is a high cost in terms of resources and loss of productivity to our economy, and also it's costly to patients as they lose stability and have much worse long-term functioning. So trauma can intensify the number and severity of both positive and negative symptoms. Positive symptoms are more amplified with and can take themes of past traumas, particularly abusive traumas. So that would be emotional, sexual, physical traumas. Neglect is more associated with negative symptoms at first episode psychosis. Going over PTSD, with all trauma exposure, there's an increased risk of development of PTSD. Rates of PTSD amongst persons with psychosis is 10 times higher than the general population, and there's a lot of benefits to addressing PTSD and trauma early on in care of psychosis, which can improve patients' outcomes, lower that cost to medical expenditures. As patients become more stable with outpatient services, that cost is also reduced. So I also wanted to go over trauma-informed care because it takes into several aspects of integrated care and really focuses on the environmental pressures that can influence a first episode psychosis. So all providers should definitely maintain a list of referral sources and be really familiar with people in your area that do practice trauma-informed care and can take a trauma history.
Using a kind of a universal precautions approach to trauma, that we might not ever know what the traumas are that people have gone through, but if we approach it with the intent of not re-traumatizing.
Exactly. So you definitely want to form those collaborative relationships for your patient's long-term care. Providers should also acknowledge trauma, but avoid delving into details without the proper training. You need to be aware if you have minor or particularly minor, but any vulnerable group, to be aware of the legal obligations that you have as healthcare providers and mandated reporting. So we definitely want to avoid re-triggering the patients and also avoid traumatizing yourself. Vicarious victimization involves really intense emotional reactions when you hear of traumatic events, and we all need to be attentive to the signs of professional burnout. So this can really look like a lack of energy, depression, developing your own substance abuse, having frequent headaches, poor mood, changes in sleep and appetite. So involving in that uniform trauma care, we want to practice stewardship, which involves caring for the patient without taking on their struggles, and to remain safe for ourselves, having self-awareness and self-care.
And in the world of trauma-informed care, I think it's important to remember, too, that sometimes, in particular with people with a mental health issue and psychosis, those people may have had a traumatic experience related to the healthcare system. And I know that's something that Dr. Freeze used to talk about. So many of the things that we go through with the healthcare system can be very traumatic. For a person to be in a psychotic state and maybe have to be involuntarily hospitalized, or maybe the police have to get involved, that nature of interacting with healthcare can become a source of the trauma. So it's a fine line that we have to make sure we balance, of being informed, not re-traumatizing, and still doing what's right for them.
Certainly. Okay, so I have a couple of